Hello everybody! In this video we are going to touch on some important points about emergency contraception. First and foremost, all women have the right to access emergency contraception. Emergency contraception is the use of a contraceptive following unprotected sexual intercourse before pregnancy is established in order to reduce the risk of pregnancy. Emergency contraception can be used at any time during the menstrual cycle within 5 days or 120 hours of unprotected sex to prevent unwanted pregnancy. Two safe and effective options are available in South Africa. One of the options is hormonal emergency contraceptive pills, or ECPs. The window for providing ECPs has actually been extended from 72 to 120 hours. However, the sooner the pills are taken after unprotected intercourse, the more effective they are. The second option is the insertion of a copper intrauterine device. This is particularly indicated in women who wish to use the method as ongoing contraception, present late in the 120-hour time period, or vomit after taking ECPs. It is important to note that the provision of ECPs is simpler and less invasive than copper IUD insertion. However, copper IUD insertion is the most effective form of emergency contraception yet available, so it should be offered to all women. If the copper IUD is not acceptable to the woman as a method for ongoing contraception, it can be inserted with prophylactic antibiotic cover and removed during the next menstrual period when a more suitable form of contraception can be initiated. ECPs are oral contraceptive pills taken at a higher dose and in a different way than for regular contraception. The emergency contraception progestogen-only pill regimen is more effective than the combined oral contraceptive regimen and has fewer side effects. Even women with medical conditions that would usually preclude the use of ongoing hormonal pills can generally take ECPs because the hormone is given for such a short time. ECPs are available without prescription over the counter from pharmacies. Various counseling points exist in terms of emergency contraceptive pills, such as explaining the correct regimen for ECP use, discussing possible side effects of the chosen pill and how to manage them, explaining when to expect the next menses, emphasizing that it is important to use condoms or abstain from sex for the rest of the present menstrual cycle, and to explain that ECPs are intended for emergency contraception only and not for regular contraception because of a higher rate of failure and side effects. Whilst not ideal, ECPs may be given repeatedly as there are no health risks associated with repeated use. ECPs should never be refused or rationed if requested within 120 hours. Patients should be counseled that repeat use of ECPs is less effective than regular use of COCs or other contraceptives and results in more side effects. It is important to always investigate reasons for repeated requests. Please note that a regular method of contraception may be started at the same visit as ECPs are given. This reduces the possibility of pregnancy while waiting for the next menstruation. A pregnancy test should be advised if a normal period does not occur within a week after it was expected. So on this slide we have some recommended regimens for emergency contraceptive pills. You may want to pause the video here. In terms of emergency copper IUD insertion, remember that the copper IUD is the most effective form of emergency contraception. The emergency use of the copper IUD does not cause abortion if used within the recommended time frame. Depending on the timing of the emergency insertion relative to ovulation, it can either prevent fertilization or prevent implantation. It is also important to remember and emphasize that if the woman does not wish to continue using the method as long-term contraception, the device may be removed at the next menses and an alternative contraceptive method started. Please note that hormone-releasing intrauterine devices are not suitable for emergency contraception. And finally, a request for emergency contraception should be seen as an opportunity to prevent an unwanted pregnancy, as well as to counsel about the future use of regular contraception. Patients treated without judgment and with respect are more likely to initiate long-term contraception.